Hey, boss. Okay.
Yeah, I'm good.
You sure?
I said I'm fine.
It is Teen Mental Health Day, drawing awareness to the internal struggles that a lot of young people face. It can be tough for teenagers to even understand or talk about their challenges, let alone ask for help. On top of that, parents may be unsure of how to broach the subject. Well, luckily, a resource is now available that can help spark the conversations, and that this could really mean a lot for your relationship with your kids and your kids' mental health. Joining me now with more insight, mental health expert Dr. Charmaine F. Jackman. Dr. Jackman, good morning to you.
Good morning. Thank you for having me and for really bringing attention to this important topic.
It is our pleasure. So how many teens are struggling with mental health, and are some teenagers more at risk for mental health challenges than others?
So, the CDC just released a very important report called the Youth Behavior Survey, and they tracked data over the last 10 years from 2011 to 2021. And what they're seeing, teenagers across racial categories, 40% are reporting increased symptoms in depression, anxiety, higher numbers for females, 60%, and even higher numbers for youth who identify as LGBTQ+. So, this is, I've worked in schools for over 17 years and I've seen this. So it's really important that we have data that's backing up what we're seeing that's happening in the schools. Our young people are struggling. They were struggling before the pandemic. And I would venture to say that these numbers have significantly increased in the wake of the pandemic.
And the teen brain is still developing, and so it would be really hard for a teenager to on their own understand that they are struggling with their mental health. So what are some of the warning signs that we can look out for?
Absolutely. So, one of the things that I really advise parents and caregivers, trusted adults, is, the earlier that we can detect signs of mental health conditions, the better outcomes for our young people. When mental health conditions go undiagnosed, the outcomes are more severe, more poor. So better outcomes, finishing high school, graduating from college, and going on to have successful lives. When they have an undiagnosed mental health condition or it becomes severe, it will often need more intense interventions like medication, hospitalization, and those can lead to poor outcomes. So the really important piece is for parents and adults in their lives to understand what are the signs, and also for the young people. We do a lot of education with young people on what does it look like and feel like when you're experiencing symptoms of depression and anxiety. Some things to look out for are major changes in their behavior and in their mood. So you might notice sometimes you think about depression and anxiety, we only think about sadness. But actually, when people are experiencing, and particularly young people and adolescents are experiencing a mental health condition, we might see irritability. We might see apathy, like not really caring. So they may be withdrawing from their social network. They may be dropping out of activities that they used to enjoy. You might see changes in their sleeping and eating habits, decreasing grades, maybe more illness, not showing up for school or being late for school. So these are definitely some signs that you want to pay attention to, particularly if they're persistent beyond a 2-week period. You may see variations in that from day to day, but if it's going on for more than 2 weeks, you definitely want to pay attention and get support.
Dr. Jackman, we have just a few seconds left. I wanted to touch on the Sound It Out campaign and how it can help jumpstart these important conversations.
And I love that you use the word jumpstart. So the Sound It Out campaign is a collaboration between the Ad Council and Pivotal Ventures. They've created a really cool interactive tool that gives parents and caregivers really cool ways to start conversations with your young person in your life. They cover a range of topics, including just checking, how to check in, right? So moving beyond those questions that get you the one-word answer, like I'm doing good, to more deeper conversations around anxiety, identity, social support, relationships. So it's really important that young people have trusted adults in their lives, because they can come to you when they're noticing signs of distress or they're not feeling right. They can have a tool. They can have open communication with you.
That could be a game-changing tool. Dr. Jackman, thank you so much for your time. We really appreciate it. And by the way, we have posted a link to the Sound It Out Conversation Starter Pack on our website. Visit fox13seattle.com.